We got the call for a standard respiratory distress. There's this healthy woman, the same age as me, and she's having a really hard time breathing. It was one of the first people that I had encountered who I suspected had the coronavirus. My name is Megan. I'm a paramedic. I work in an urban EMS setting. It's a high call volume service. When the COVID-19 epidemic really hit, it was very stressful. All of a sudden you have your 1N95 mask, and that is your protection against this deadly disease. You probably see a lot more COVID patients than in a rural setting. It's harder to distance when there's more people. And some places like nursing homes, jails and prisons, and homeless shelters, we just automatically assume that our patient has COVID, that there's a lot more of a risk of somebody dying from the disease than from a regular cold or flu. Every call we wear 2 masks. I usually wear a scrub hat, goggles, gloves. It was terrifying to think about being a carrier of this deadly virus. I have 4 kids. You get home and your rush of kids that just brings you so much joy, and you can't immediately go and pick them up and hug them. You have to get yourself clean and safe for them. It was scary to think about, yes, it could infect our kids and it could lead to them being on a ventilator. The biggest thing that you can do to support healthcare workers is to wear a mask. Things may be a little inconvenienced, that's just a fact of life, and we're never going to beat this thing if we can't play by the rules and care about each other and care about the community.